Hey, everybody. Welcome to the Feminist Sleeper Cell podcast. I'm here with Marie, Liz, myself, Moji, and we're here as we are every week to talk about shitty laws from shitty politicians, shitty legislation from shitty legislators, shitty shit that shitty people say. And of course, this is our third episode from our podcast extravaganza, third trimester situation. Like, yo, we've just been doing it all. We've been talking to amazing people. We're going to talk to someone else amazing in a few moments. But first, like, hey guys, how you doing?
I'm excited. I feel really excited that we decided to do, it's our 99th episode. And instead of just doing a 99th episode, we decided to do three, it's an episode-a-thon, I
Yeah.
think is the word we made up. So three big episodes, talking about three big sort of overarching, how did 2020 look in the Supreme Court? How did it look with regulations and federal shit? And I'm excited to be on a video cast with you guys and see you.
I know. Yeah. It's been
Yeah.
pretty great. Marie, how are you?
I'm good. I like this approach. It's a great way to divvy up the year and see the horrific things that have occurred or not been attended to and allowed to just sit there and subsist, but also the positive lights and the folks, the activists out there that are getting it done, that are making sure we have access to care, the doctors, the nurses, that whole community. Those are the folks that keep abortion going.
That's right. And we like to keep them going. I mean, I'm really proud of our work as far as like really tuning into how hard and how exhausting it is to provide abortion, whether that is being a physical person who works in an abortion facility, being somebody who is doing practical support work, helping folks get to their abortions, and helping fund their abortions, you know, that and escorting patients trying to get it. There's a community of people who work really, really hard. And I feel lucky that we're part of that community. I also feel lucky that we have 3 solid hours. This isn't a 3-hour podcast. We've broken it up. So if you're listening to this one and you didn't know that we did 2 other dope hour-long video casts, they're all available for you. Just wherever you're watching this, look at the one before and the one before that. And watch them all, listen to them all. It's dope, 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 dope.
Yes, it really, really is. But so that this isn't a 3-hour podcast, let's get into some of the things that we saw this year, starting with breaking news. Ding, 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 ding. Shitty legislation alert. Hit us, Marie.
Yes. In the year of bad legislation, the worst law happens on the day we're doing the podcast about the worst legislation in 2020.
It is literally Breaking Bad. Back in 2017, Arkansas tried to put in place state measures and legislation to restrict abortion access for the individual, from gestational, whole bunch of lenses. And thankfully that's been stopped. However, today, this week, as we've been filming this, the Eighth Court which services this area, the Eighth Circuit Court of Appeals denied both the ACLU and the Center for Reproductive Rights, which are the two big organizations that often come in with that court-based approach. Well, now we're worried because in Arkansas, there's a couple of laws now that are set to go in effect on December 22nd, and they are harmful both to minors, both to individuals who are pregnant beyond 14 weeks, because something that these regulations would do would be not allow doctors to provide dilation and evacuations. Incredibly common.
That is. Marie, let's break these down one at a time, right? So that people can really get what's in this bill and what they're saying, what they denied the lawsuit for. So first, let's start with later abortion and dilation and evacuation. Explain what that is.
So dilation and evacuation is an incredibly safe, common process that usually occurs later at the end of the first trimester into second trimester. And it is a process that in Arkansas, non-doctors have deemed that from a variety of different lenses, that it's unsafe, that it's cruel to the fetus, all of these things that they've taken to determine that this safe medical procedure should not be allowed. And the Eighth Circuit Court of Appeals has not blocked that. So come December 22nd, this is a concern that the state is literally telling doctors you do not get to do this safe method of care for individuals.
Well, also, I just want to say that where Arkansas is situated geographically, there are no states around it that also allow later abortion care. And so a person who needs later abortion care is going to have to travel really, really far to be able to access this super safe procedure.
Yes. Another really, really toxic piece of this legislation is that the patient's partners or family members have to be notified about their abortion.
That's
like legal.
HIPAA violation. Like how? I mean, no one gets notified when I have a wisdom tooth pulled. Not once.
No.
Not ever.
Right? Are they mandating birth announcements if this pregnancy is one someone wants to carry? Like what the fuck? Do you want to pay for my Vistaprint postcard that's going to get sent out to everybody? Like, here's my embryo at 12 weeks.
I just don't understand how a medical procedure that's legal, forget about how you feel about it, someone else is notified about it. I don't understand how that's going to have to go to the Supreme Court, because that cannot stand muster.
It is just so horrific, so invasive, the invasion of privacy.
It also says ownership. Like, can we just, before we move on, I'm so mad.
Yep.
Also deems your body
Yep.
that somebody else owns you, whether that is a parent, whether that is a partner, that they have ownership over your body. Like, what?
That is wild.
It's really, really just horrific. This legislation also would force a center of care, whether that be a clinic, whether it be a hospital that the individual is going to, if they are a minor. And in Arkansas, they're looking at that at 17 and under, the healthcare center is going to be required to report the patient's abortion to local police. And then the state crime lab can hold onto that minor's medical information. All under the guise of, oh, we're worried about sexual assault and sexual abuse. So this is how the police are going to police that.
I mean,
the policemen get to know if you've had an abortion.
Yes. Why do policemen need to know?
Yep. They're tying this to an existing law that is specifically for folks 14 years and under, which again, I'm sorry, if you've been sexually assaulted, regardless of age, you must have care, must have support, all of that. Also, you need to make the decision what you need assistance with first, and you need to be centered. So if abortion is what you need, why on earth are we bringing in, the local sheriff now to be involved and know about this? Why can't
Why should your medical records be in a public space anywhere? Yeah. Some religious cop all of a sudden decides they have access to a database. Mm-hmm. Some small town where everybody who works at the police department, and all those people get to know that you had an abortion. Like, no, that's
like details, right? You had a 12-week abortion at this day. Like, it's so many, it's so insidious. And I'm flabbergasted that this is okay.
Also, think about this. You had an abortion, the police know you've had an abortion. Then all of a sudden they deem you a whore for having an abortion. Mm-hmm. And all of a sudden, someone in your family is having a heart attack, and you call 911, and your name is now flagged as having an abortion. They're like, too bad for whatever's happening at that house. They had an abortion. I'll get there when I get there. Yep. Just unbelievable.
Policemen and care for people, and so they have their personal opinions. This is really. And also, like, police don't have the best record.
No.
Talk about defund the police. You know what we don't need cops doing? In anything to do with my abortion. Literally, no one asked you. Is like the neon here. Oh my God. And the courts have upheld this and said that these are all fine legal things.
Mm-hmm. Yeah.
What's the next step?
Wait, we forgot one other thing.
Oh, jeez.
There's also encompassed in this is the physician, the abortion doctor, their office is required to get a bunch more medical records from patients without justification. So this delays people's care too, because now, okay, maybe you were fortunate to have medical care in the past. Now your abortion provider has to request that info. Or maybe you haven't gotten care because it's fucking Arkansas and, the US doesn't care about pregnant people, period. So you need to bring in all these materials that may or may not exist in order for you to get an abortion, that your provider has said, hey, we don't need these materials. We've been doing this for years. I went to med school. I know this stuff. Yet the state is saying, no, we want you to collect all these, check all these boxes. And of course, the end result with this legislation, like it is in all other states, is the state saying, we're going to go after the provider. We're going to find this individual. They can be jailed, things like that. So then the state can step back and say, oh, no, we're not harming the person seeking the abortion. This isn't an undue burden on them. We just want to keep those fucking providers in check in these ways. No, you are affecting the bottom line, which is the patient. Always.
It's so, we had planned on talking about like some of the shittier laws that had happened in 2020. And this is it. And I'm like, I'd be remiss to not mention, how many states tried to have 6-week bans. The fact that the Supreme Court also upheld the fact that the Indiana law from 2015 saying that it's perfectly fine to require cremation or burial for miscarriages and abortions. So that's just another burden. That's garbage. And not to mention how many states have been trying to force doctors to talk about abortion reversal in their practice and in their counseling of care.
Which is not a medical thing.
Not a medical thing, So there's been a lot of crap laws, and those are the ones that have been just the worst. And let's see what happens on December 22nd in through the courts. But there have been good things that also happened in 2020. And before we get to our guest, let's hit some of the good notes and maybe some hope for the future before we hop into our dope ass guest. What, Moji?
I was personally super excited when Colorado shot down Proposition 115, which is the proposition that would have essentially ended later term abortion in Colorado. And I was particularly excited because during a pandemic, antis did literally the most to get it on the bill. And I like that the people of Colorado said, thank you, this is not what we need right now.
It's really a great victory. And I love that you picked this story because for me, putting something on the ballot and having the voters decide, and especially something that, again, if you're not like us in the total abortion movement, you hear so much rhetoric around later abortion that it could have gone the other way, where clear-headed folks who don't know a lot about why folks have later abortion could have been, I'm okay with abortion, but not to us, they were just like, nah, we're good. Abortion, people needed their abortions. And I love that. I'm with you. That's a good one. Marie?
I'm especially excited about Massachusetts. They are making efforts to try to, they're trying to make abortion access codified within their state and have funding available for abortion procedures. And this is something great that we've seen happen on state levels with RHAs, reproductive health care amendments, and we've seen on city levels, like within New York City, like within Austin, Texas. So there's lots of folks, because hey, this has to be our response to the sanctuary cities, like, which are not, spoiler alert, sanctuary cities for Black and brown people that, are being terrorized because of fucking where they were born and immigration status. These are sanctuary cities for the unborn. So what we have to do, and we have to do this from a budgetary perspective, we have to do this from a legislative perspective, is pass these measures. And Massachusetts, thankfully, which has a governor supportive, we're really hoping to see Massachusetts codify and put in place funding for abortion and the promise that folks coming to Massachusetts, residents of Massachusetts, have access to that care.
Yeah, I think that is also a great one. And again, it's so important as we've seen in 2020 and moving forward into 2021. A lot of these states, Minnesota being one too, challenging the laws on the books, like getting rid of the garbage laws that were languishing around that became illegal because of Roe, thinking, oh, we've actually become civilized humans. We're never going to go back to a time where these laws were going to be good, like, permission from your husband, et cetera, et cetera. Well, guess what? Roe is now clearly, as we've heard from Dahlia Lithwick and everybody, it's clearly on the ropes. And if it gets overturned, there's a lot of states that have trigger laws that say abortion will immediately be illegal in our state. And there's also some states who are saying, let's get this shit off the books. Let's have clean slate. Let's be a haven for people if they need to come. So I love hearing that. And I'm hoping to hear more of that in 2021. I don't know. I think there's, as far as like good stuff, I feel like I'm going to go with Kamala Harris just driving the agenda of reproductive justice and expanding abortion access and talking about reproductive justice as a whole and really centering and thinking about what that looks like. Even she's going to take it to a certain level. And I feel excited that we going forward are going to have somebody that we can present information to, challenge their thinking, and have them move forward as far as when we see what we need, that we will be pushing for that. And so I feel like on a state level, people are kind of waking up. I feel, except for Arkansas, apparently. And I feel like there's so much more we can do.
Yeah, that's really what it is. There's so much more we can do.
Yeah. So Marie, do you want to introduce our guest coming in?
Yes, we are so excited to have Renee Bracey Sherman joining us today. She is the Beyonce of Abortion Storytelling. She is also the founder and executive director of We Testify, an intersectional abortion storytelling organization that in particular hones in and focuses on those communities that we know are facing some of the hugest financial and logistical barriers, communities whose race, class, gender, age, all of these factors affect where they can get care. And as we've talked about, geographic location plays huge into that. So we are so excited to have Renee join with us and talk to us about best worst state legislations in 2020 and what the true people on the ground, the patients, the abortion storytellers face. We're so happy to have you with us, Renee.
Thanks for having me. And I'm wearing my Ivy Park.
Yes. We were running through great holiday gift ideas, and like those are on my list. Like we need that right now more than ever. So as we discuss, this is going to be our best and worst of state legislation in 2020 that we're going to talk to you about. And starting off with We Testify. Your storytellers come from every state, from diverse backgrounds, from faith, gender, class, and their urban and rural communities. Can you talk to us a little bit about why storytelling in particular is really crucial in combating state legislation that is so harmful from a reproductive rights, reproductive health, reproductive justice lens?
Yeah, well, first, thank you so much for having me. I'm so excited to be closing out the year with you all.
Yeah.
Storytelling is super important because we need to really help the general public and other people who have abortions understand what our experiences are like, build compassion and empathy, and really illustrate how draconian and awful and terrible all of the restrictions are, whether they are financial, logistical, legal barriers, or just stigma barriers. And I think people don't necessarily think about how much stigma can be a barrier to someone physically going to get an abortion. And so with We Testify, we work with people from all over the country who've had abortions to share their stories and really push back on all of the stigma and shame and kind of censoring that happens with abortion stories, even within the pro-choice movement. So supporting people in sharing their abortion stories, whether they've had 1 or 6, whether they had it at 5 weeks or 32 weeks, whether they had it for a medical indication or because they don't want any fucking kids. Like all of it is fine. And really pushing back on this idea that there's some form of acceptable abortions and unacceptable abortions. And we see that a lot when it comes to state legislation, right? Because they'll try to pit people who have abortions against each other, or people who have miscarriages against people who have abortions, or the disability community against people who have abortions, right? And assuming that those aren't the same people at different points in their lives. Disabled folks have abortions. We have a number of disabled storytellers who can talk about actually this law that they're pushing to try to help the disability community is actually harming a disabled person like me, right? We have folks who are pointing out that they actually get the same medical care when they're having an abortion and a miscarriage. But if you go and say you want an abortion, Medicaid won't cover it in your state. But if it's a miscarriage, Medicaid will cover it. And actually showing how they're pitting us against each other based on stigma, right? And that's the same person who's both having an abortion and having a miscarriage. But because the intent differs, they're treated differently by the state law, and sometimes by their providers, and by people in their family, their loved ones, their community, right? And so we really want to break down that stigma that exists and allows people to just hate on all of us who have abortions. And by proxy, also people who have miscarriages too. But there's a lot more empathy for them because it's seen as something that wasn't chosen. But at the end of the day, like we saw when Chrissy Teigen shared her miscarriage story, that or later abortion, I don't know how she's identifying it, but at the end of the day, it's actually the same medical procedures. I don't know how she's identifying a pregnancy loss. We could go with. The stigma and the hate that she experienced is all the same. So we're actually all in a spectrum. And all of these laws are going to impact all of us. As they outlaw abortion, that's going to mean that people who are experiencing spontaneous abortions, miscarriages, are going to lose access to healthcare as well. And so a lot of the abortion storytellers share their stories in their communities with state legislatures to push back on these laws and to make sure that it's clear that people who have abortions aren't taking shit. We are talking back. Like, we are not sharing our stories just to like feel good. We are fighting for our liberation. We are fighting to be heard, and we are fighting to make sure that we can get our next abortion. And it's just that simple.
And I wanted to thank you so much for your work. When I started doing this movement work, you're one of the first people that I met, and that was like so loving and embracing, and also just like
you were too.
We learned about reproductive justice in a way, and calling in when I was one of those people who used interchangeably reproductive justice with reproductive rights, and really learning and then taking it further and working through the lens. But one thing I would love for you to talk about is why the storytelling needs to happen, because we talk so much about the laws and about Roe and all this stuff, but unless we have the stories out there en masse from all the different places, it's still going to be okay to propose these laws, and how important it is for the storytelling
right.
to change the narrative to shame the people who are making the laws, not the people who've had abortions.
Right. And I think one of the things that's really frustrating is that we don't necessarily think about stigma as the way in which we have been socialized to hate people who have abortions. It's on television, it's in the news every day, our politicians spout it, right? It is okay to treat us like crap. It is okay to yell at us outside of a clinic. It is okay to yell at us in our family and to ostracize us from our family. And so with storytelling, the way I think about it is actually the first and foremost people that I want hearing the story are other people who have abortions. I want us to see us in our best light, and to be able to say, like, look, you're a badass. I had an abortion just like you did. I had several abortions just like you did. Like, it's cool. And we can talk about that, and we can talk about the nuances, right? And then after that, hopefully those folks will feel more supported and loved to share their stories with the people in their lives, and then actually activating people to push back on these laws. And I think one challenge or frustrating thing I used to hear was like, well, if everybody would just share their abortion story, we like wouldn't have these laws. Well, guess what? A whole lot of people know Black people and racism still exists, right? Like a whole lot of shitty men are married to women and like haven't solved that. So it frustrates me because there's this idea that, you know, it's on the abortion storytellers to like fix it all. And yes, we're going to fix it for us, but also like you all got to get up and like actually speak out and say something. And I think that the more confidence that we have about our experiences and sharing our stories and all of those things, the more we can push the people who love us to love us in public and to defend us in public. And one thing, like, you know, with the phrase "everyone loves someone who's had an abortion" that I coined as a tagline of We Testify, like, what's really important is asking people to love us and to support us in public, including politicians, right? Because politicians like to distance themselves from us and be like, oh, well, I'm pro-choice, but like, I don't love abortion. And like, let's not actually talk about the people who have abortions, right? And it's like, dude, how is that helping us? Like, that's just love us and just say, yeah, people have abortions, vote, they live in this country, like let's show them respect. How hard is that, right? I mean, we have an incoming administration that won't even say the word abortion, and I'm feeling frustrated, and I know all of the We Testify storytellers are, about how can we trust that an incoming administration is going to defend us as much as we need to not only restore, but expand abortion access if they won't even say the word abortion, if they won't even defend our humanity and our right to liberation without codifying it and being like, okay, but we don't really like them too much. Like, you know, okay, well, of course, I believe in the right to choose, but like, it should be rare. Like, that is so shitty. Like, how would you tell somebody to say, like, oh, I believe in your right to healthcare, but just like, don't get too many shots? Like, what?
Also, without naming names,
Rude.
you and I, Renee, have in the last calendar year, I'm just going to put it that way, we're on a call with pro-choice activists.
Just a general call.
Pro-choice activists. And one of the questions that was raised by someone who is a leader was, do you think we should be really calling people, a new administration out when they put up people who are not in our interest? And I was
right.
like, yeah.
Duh.
Question, how should we be? Not should we?
I don't know about you, but my paycheck doesn't come from the incoming administration. So I am going to call them out.
Yeah.
And I'll also say this.
Parties. I don't want to hang out with them. I don't care what kids go to. I'm not your friend.
My friends are people who have abortions. And if I am not unapologetically out loud supporting them and making sure that every single person who has an abortion, however they feel about their abortion, however many abortions they've had, why they had their abortions, I'll defend you. I don't care. You deserve defending. And I'm not going to be a lapdog to someone who won't even say the word. And it's like making new euphemisms. There have been, over this campaign, I've mostly kept sort of quiet about it, but there have been some euphemisms I've never even heard of. I mean, we're used to the like, well, women's healthcare choices and reproductive choices and decision making. And I mean, there are some gymnastics of euphemisms they've used in order to not say the word. And I think that in itself is stigma. And so how can you call yourself a pro-choice champion or be naming who pro-choice champions are if you are allowing this to thrive and letting this be the ask that you make and what you get for an endorsement? Mm-hmm. And I'm sorry, I think that we need to hold our friends accountable and we need to stop selling people who have abortions out. And our movement has done it intentionally and unintentionally for a long time. And I'm tired of it. I'm just so tired of it.
I
mean, whatever. I'm always here to cause trouble. So
I love that. And I have to tell you that I cannot wait till you all turn 50 because it really, because I mean, like you're the fucks that you give are minimal.
I turned 35 and I am pretty sure I have none.
No, you always
in some of these conference calls, but
you have one until you turn 50 and then you drop that last one and you flush
the
it.
Tiniest of fuck.
And you're just in there, or else you're wasting your life.
It's honestly, I'm like, well, honestly, okay. So my question is, what are we doing with our work, and who are we here for, if we are not going to defend the people we say we serve, even to our friends and allies who are hurting them? Mm-hmm. If we were at a party and one of our colleagues was talking shit about our best friend, would you not say something and say, hey, can you stop saying that? That's terrible. That's hurting my friend. It's the same thing. We are telling you that the way you're talking about this issue, the way you won't say the word abortion, the way you defend the Hyde Amendment, or like be like, oh, okay, I'm for repealing it, but like, let's not really talk about it. That is hurtful. And if you want to be, the pro-choice administration that you say that you are, well, show up and come to the table and actually talk to people who've had abortions. Because I mean, I don't know about you, but I've never been invited to any meetings with the incoming administration, not one. And I know they're happening. I know they're happening, right? And so my question is like, why aren't people who have abortions at the table? And there have been a couple of times where we've had to push to make sure that people who had abortions were at the table meeting with the campaigns. And that is really sad, because how are you getting advised on an issue and not actually having the people who were impacted by said issue at the table? And I cannot wait for some accountability to happen in the next 4 years. But what is important is that all of the people who were in the persisterhood and the resistance and whatever else.
Sisterhood and the persisterhood.
Yeah, I really hate that word. You need to be as hard on this next administration in calling for the expansion of abortion access, not codifying Roe, because Roe is barely there holding on law that we don't really want to begin with, but like it's messy, and it's actually holding in structures that need to go. We need a new way of abortion access in this country. And so being okay with and saying yes to the bare minimum, we can't do that in 2021. That's got to go. And just because he's not Trump and he's not actively sterilizing Black and brown folks in immigration jails and other for-profit jails and state jails, like, doesn't make him better. And I don't know, maybe I've missed it, but I haven't seen a promise to, one, take everybody out of those ICE detention centers, two, reunite all of the children with their families, and three, where are the reparations for those folks who have been forcibly sterilized? I want to, where's that in the first 100 days plan? Because that's what reproductive justice
or
is.
Just as simple as day one, get those kids out of cages, like day one.
Honestly,
let's start.
Honestly. Sign that while you're making your speech. Read the teleprompter of while you're doing your "thank you, I'm now the new president" speech, and start signing. I can talk and write at the same time. I bet you can too.
Right.
Do it.
So this has been, we've talked storytelling, but this has been a wild legislative year for us regarding abortions. We want to cover, of course, some of the best, some of the worst, and so that we can only go up from here. Let's start with the worst. So what do you feel like is the shittiest piece of legislation that came from 2020?
God. I'm like, where were we in? I'm like, what was even in 2020 at this point? I think, God, I don't know. I mean, they're all just so bad. We had a bunch of the 6-week bans. There were a bunch of the 15-week bans. I don't know. Mississippi is trying to figure their shit out and figuring out where they want to ban. They're just like throwing darts at numbers. Like any of those gestational bans have been awful because they are trying to actually gut at legal access, but they also serve to really confuse people as to whether abortion is legal or not. And I know that those aren't just in like we've been having those for years, but because they've been built up and on top of the Supreme Court case in 2020 and the Trump administration, you know, what we hear from folks who are trying to get abortions and have had abortions was the level of confusion around whether access even existed. And then combined with the coronavirus pandemic, where Texas tried to like just straight up, I mean, they really did not have abortions for 2 weeks. And a number of other states tried to ban abortion. I mean, I think that level of trying to attack people when we're dealing with a global pandemic, it's just so gross and evil. And so I think like all of that combined has just been so stressful. And I think we definitely get a lot of people who are looking for abortions in the We Testify inbox and or like are like, I'm about to get an abortion. What do I do? I'm scared. You know, we had a We Testify storyteller who needed abortions during the pandemic. Some who were able to get them. One was in Texas and had to self-manage her abortion. And I mean, she did so safely and it was fine. She had a little bit of excessive bleeding because of her iron levels. So she did go to the hospital, but like she told them she was having a miscarriage. And guess what? Medicaid covered her abortion. Mm-hmm. Huh, isn't that funny? But like it was all caused by the state deciding to just like shut it down. And I think she is someone who, when she had her first abortion, it was a little bit after HB2, and she was unsure as to whether abortion was legal in the state of Texas. So like as I'm saying, like all of these combined just creates this environment in which people are unsure of what's even possible. But yeah, fuck Greg Abbott in the under investigation. Is he gonna lose his job?
No, he's not under investigation. Ken Paxton.
Ken Paxton. Oh yeah, fuck him too. He's the one who put the fuck him up.
I was gonna say we could just say fuck them all. I feel like
happy under investigation.
No,
yes, Paxton's under investigation.
I think
let him lose his job.
We'll like talk about terrible stories and we'll just have to end it and just be like, abortion is also still legal in St. Louis because
really,
because sometimes you'll just like the stories will be so insane, it really will feel like it changes week to week.
Well, and I feel like we need as a movement, like I feel like there should be funding solely on the message, abortion is still legal. Don't let anybody tell you differently. And like just letting people know that, because you're right, people don't know.
A lot of the funds do some of that messaging in like especially in times Ohio, the Women Have Options Ohio, that abortion fund was like being very clear when they had their attempt at their 6-week and 20-week ban, and then also when Ohio tried to shut down abortions during the pandemic, but I believe they were unsuccessful. But there was like, they had a whole like messaging, like abortion is still legal. It is still legal. Like you can still get it. And I think the fact that we have to have that as a messaging, it just shows how just like bad access is right now. And that the anti-abortion movement has worked really hard to sow a lot of confusion. And I think that we saw so much of that just like in those first couple of weeks during the pandemic, when states were like shutting down. And then also like, is abortion an essential service? And even in like, quote unquote, like, I don't know, I hate blue states, I guess, but like the places where abortion is like accessible, there was still confusion there, right? Because the other states were trying to shut it down. It just confused people. And I think it's, I don't know. So whatever, fuck Ken Paxton.
And also just to be able to, the fact that we are like, why your work is so valuable to me, one of the many reasons, but the fact that it was effortless for states to say abortion's not an essential service,
right,
is why storytelling is so profoundly needed, because we need that to be a shocking statement. We need to create an environment where that's a shocking statement. Like, how could you say that? And we need
and then you can
to feel that.
Right. And that you can get away with saying that, well, they can just wait and delay the abortion until the pandemic's over, which, okay, first off, we're still in it. Second, abortion is like one of the few parts of healthcare that, like, I don't know, dealing with like gunshot wounds and, like, I don't know, a heart attack, that, like, you can't just be like, can you hold on a couple of weeks? Like, no. People, it's actually kind of time sensitive because there is an end date to it. Yes. And our laws give you an end date to when you can get it. And then they just, like, are so awful towards people who need later abortions, being like, what took you so long? I don't know. Ken and Greg decided to tell me I had to wait. What do you mean? What took me so long? So, and I also think that that's where our movement could do so much better in actually showing up for people who need later abortions and really making the connections that all of these, like, laws are pushing people to later in pregnancy. So no, we shouldn't only talk about later abortions that are based on, some testing or pregnancy diagnosis. That actually everybody should have an abortion whenever they need it. And we should be making sure that people can have them as soon as they want them, whether they realize they want it at 26 weeks or 4 or 5. Like, people should get them. And I think it's really frustrating the way that our movement kind of apologizes for later abortion, because we have a lot of folks who had abortions in the 2nd and 3rd trimester, and we testify, and it's mostly because they experienced judicial bypasses. Medicaid wouldn't cover their abortions. I don't know, the state shut down abortions. Like, even for our storyteller, Marie, when Texas shut down the clinics, you can actually read her story. It's in Cosmo, or we did it in a comic book version, illustrated. It's on our Instagram and on our website. But it took her several weeks for the pills to arrive. Why? Because our president was slowing down the mail because he didn't want people voting. So, like, not only did the mail slow down, hurt people getting paychecks, hurt people trying to vote, it also hurt people trying to be able to get their abortion pills in the mail, whether they were self-managing or because, a judge decided that, yes, we could stop the in-clinic provisions or requirements during the pandemic. So shout out to that judge who did that. But anyway, sorry, that might be skipping ahead to, like, good news.
No, also, as somebody who's had multiple abortions, and my first one, I was young, I didn't want to be pregnant. So I took a lot of time to make sure I wasn't pregnant. Like, that was my process, is to wait and wait. And I had 14 weeks at my first abortion, and so, like, I'm sorry, shout out to being scared. Like, shout out to not wanting it to be so. Like, that's a real thing, people. If your active denial is not a factor in the world that you live in, you can die in a fire. Because
once somebody said to me, "Oh, we'll send people one pregnancy test," I'm like, if you think people who don't want to be pregnant only took one pregnancy test, you're an idiot. We take 12.
They sent an astronaut to space with how many tampons? But we're going to give you one pregnancy test. One.
Like, what?
I know. That's true.
I will also say the antis, I wish they would, like, I don't know, pick a theme, because they're both like, abortion is such a really difficult decision and you should take all the time in the world you need to think about it, because it is a life-changing decision, which so is having kids. But also then they're like, what took you so long? Why did you wait? And you're like, which is it? And I think, I think, like, stories like yours, Liz, is just, like, so important to say that, like, yeah, people should be able to take the time to think about it. And also, if people know that quickly, great. Like, we should be able to take the time that we need to make that decision and get the abortions when we want, whether it's at 14 weeks or, 30 weeks. Let people have them.
Renee, I like you pretending that antis make sense.
They have a team and a branding. They have a campaign.
How giving of you. Jeff, that olive branch, you're reaching across the aisle.
Okay, sorry, let me make it clear. Antis, fuck off.
got no time for olive branches.
I know, I'll burn my olive branch.
I voted for. That's who I'm putting pressure on. The person who I voted
Right.
for. You know, make the world a better place. You fucking racist.
Truly.
You also have a job. I'm annoyed.
No.
No.
My olive branch goes to the next administration. I'm like, okay, great. Here's the olive branch. Let's figure something out. And also come over here.
You touched a little bit on positives that you've seen within the state and within this year. I wonder, so in terms of, for instance, on a federal level, restrictions being lifted to allow the abortion pill, medication abortion to be available for some people in some states to access.
Yeah.
What are other exciting wins, or at least steps in the right direction, that you've seen within 2020 for states to have equitable abortion care legislation on the state level?
Well, I want to pause on that one for just a second with the judge's ruling, because I think it can be kind of confusing to folks. So basically what the judge said is that, yes, it is unreasonable to require people to travel outside of their home in a pandemic, to go to a clinic, to pick up medication abortion pills, particularly mifepristone, take it at the clinic, and then you take the other 4 pills of misoprostol at home the next day. And then you actually have the abortion at home. And in a lot of other countries, they just mail all of the pills to you, or you just go to a pharmacy and pick them up. But because of the way that mifepristone is restricted by the Food and Drug Administration, it cannot be picked up at a pharmacy. It cannot be just like mailed to you. It has to be distributed at a clinic. And so there are several lawsuits that have been in the works for years. One is an abortion provider in Hawaii, where their patients have to travel to another island to be able to get the pills, which is ridiculous, right? And they would like their patients to be able to just go to a pharmacy and pick it up. And so what this, right. And what this judge said was it is ridiculous to make people leave their homes when we're supposedly observing stay-at-home orders. And so in certain states, those restrictions have been lifted temporarily, so the pills can be mailed, which is huge. And that means that clinics are able to support more people. They don't have as many people in the waiting room, so there's minimizing the risk of people contracting coronavirus being out in the world. But that's also starting to prove that, oh wait, we don't have to go back to the way things were. We could do telemedicine in this way, or we could just ship the pills to folks. It's basically proving all of the lies that the anti-abortion movement has been saying for so long about that medication abortion is dangerous, even though it's safer than Tylenol, that it needs to be, you need to be in front of a doctor to take the pill, right? All of the stuff. You don't actually need that. So hopefully this would mean in 2021 that we're further, that the FDA would lift the REMS. I think as far as other exciting things, I have to touch on the Hyde Amendment hearing, the hearing on the harms of the Hyde Amendment that we had just a week ago. I don't know what time it is, but a Tuesday last week, I think. I know it was on a Tuesday. It was phenomenal. Yeah. So the Hyde Amendment is an amendment to the budgeting process that basically says that any federal health insurance programs cannot cover abortion. No federal funds can be used for abortion. You'll start to hear the anti-abortion movement saying, and sometimes actually pro-choice people saying there's no taxpayer funding of abortion, this, that. 2 things. 1, people have abortions, pay taxes, so fuck off. 2, that's discrimination. And it's super racist discrimination. One thing that came out of the hearing, Representative Barbara Lee said she was working, I believe in Shirley Chisholm's office, or at least on the Hill, when the Hyde Amendment was being passed by Representative Henry Hyde. He's from the great state of Illinois, where I am from. I apologize.
Also,
and
serial philanderer.
He's so gross. So gross. Yeah. So this man who has morals for everybody else, not himself, said a lot of really disgusting things when passing the Hyde Amendment, and basically was like equating abortion to like gambling and other vices that women have, and saying like this is not something the government needs to pay for. And in the hearing, I had never heard this before, but Representative Barbara Lee said, you know, the only people that this amendment would impact would be little ghetto kids. That's what he said. And I was like, wow, this man is like so racist. Like, we know it from the policy, right? Because it is controlling anyone who's enrolled in Medicaid, which is, if folks don't know, a health insurance program for people with low income. It's a means tested program. Anyone who is in the Peace Corps, federal employees in a lot of states, state employees, anyone who is in the military, that's a little technical, it's on another piece of legislation, but whatever, it's all in the same. But any sort of federal health programs cannot be used. States can use their funding to pay for abortions, and a number of states do, like California, and most recently Illinois began to. But what's frustrating is that federally, this is the policy, and this is something that has been upheld in the budgets of pro-choice and anti-choice administrations for over 40 years. We finally have, for the first time ever, an incoming administration that has pledged to repeal the Hyde Amendment. And so with that, Representative Rosa DeLauro took over the House Appropriations Subcommittee on the Labor and Health something. Someone else can tweet out whatever, I can't remember what it is right now, but whatever, it's a long name. Anyway, she got her new chairmanship. And so she decided to have a hearing on the Hyde Amendment and the harms of it. And it was really beautiful. Dr. Jamila Parrott, the president of Physicians for Reproductive Health, testified about the impact on her patients. Dr. Herminia Palacio from the Guttmacher Institute testified as well about the data behind the harms of the Hyde Amendment. And Lilith Fund and We Testify abortion storyteller, Amanda Williams, testified and shared her abortion story. All are women of color. Even the anti-abortion witness was a Black woman. So all of the witnesses are women of color, which was like huge, which I also think is kind of great because we forced their hand that they had to send a woman of color, even though their movement's super white. So, and I think they had to defend that this policy is racist. And, you know, all three witnesses, Dr. Parrott, Dr. Palacio, and Amanda, really outlined the racist impact of it, and the racist legacy of our federal government controlling Black and brown people's fertility through different means, right? And then we testify, all of our storytellers, we had 10 storytellers submit their stories to Congress about, and most of them about why they couldn't, it was hard to get an abortion because Medicaid wouldn't cover it. And then two from Massachusetts, who said, actually, Mass Health, our public health insurance, does cover abortion. And here's the difference it made in my life. And I did not have to wait weeks and weeks and weeks on end to raise the money to pay for an abortion. So it was really important for us to have stories like represented and in both in the oral hearing, but also in the testimony, to really illustrate the impact that this amendment has had. And our hope is that we get a clean budget, that you know, every year the budget is passed on the backs of people who have abortions. A lot of things are traded away on the backs of people who have abortions, including the Affordable Care Act. They snuck in the Stupak amendment that said, yes, you can have the, yep, he was a Democrat.
Just always have to remind
And I have heard that from people who were at the table at the time, I was not, that our incoming president was actually helpful to some of that, which is very disappointing. And so I think that's why people have abortions distrust a lot of the process, because when push comes to shove and we're fighting about, whatever things, the ACA, people who have abortions get tossed out first. And I think that's really, really frustrating. Even right now, we're talking about having a conversation as to whether or not to repeal the filibuster, right? To abolish the filibuster. And so that whether or not and there's a debate as to whether or not that would help us get some pro-choice legislation through. The anti-abortion movement has already started making videos and talking about how the filibuster is pro-life and it is keeping us from being able to have abortion access. So again, here's a conversation so like boring, right? The filibuster. Yep. And people who have abortions are being put front and center and are being blamed for it and are the ones who are getting hurt. And I think it's really important that if folks want to continue to push the next administration and fight for access, put people who have abortions front and center and make sure that we get what we need, because then everyone will, because we get tossed out first.
Well, and I think too, it can't be stressed enough, and it's a good gut check for yourself, is your own passivity and watching the passivity of people who are elected officials. Not only are they, they're at those tables, but when you actually ask for agency, they dismiss it as something that is a wedge or that is getting in the way of something more important. And so really looking at that, I think is important. But the one thing I wanted to just go back with you really quickly, Renee, is what did the Black woman who came from the anti-side, what was her argument for HUD?
Oh,
That she made?
Well, so she is a woman whose mom apparently had a choice. It was really fascinating. Her mom was pregnant with her and was considering having an abortion and felt pressured to have an abortion and then decided not to, which is really cool because her mom had a choice. And I thought it was perfectly illustrating the entire point of this entire conversation. And Dr. Palacio, had such a beautiful point, was like, I'm glad that, her mother had a choice, and I'm glad that Amanda had a choice to have an abortion. That's what this is about, right? But her position on maintaining the Hyde Amendment is that it quote unquote saves Black babies, but also that, there is the data that 1 in 4 pregnancies or people are forced to carry pregnancy to term because of the Hyde Amendment. So it's saving untold number. They like had several different numbers that the behind the scenes could not even figure out where they got those numbers from. But they were just made up numbers. They were like 6 billion, 3 billion, 4 million, 28. Like, where did any of those numbers come from? But that's how many lives have been saved because of the Hyde Amendment. But there's so many fallacies within their argument. One, because the reality is that people who have abortions, the majority already have children. And so this idea that because the Hyde Amendment's in place, it can have people continuing pregnancies and like not having kids, that's not true. People do have kids already, or a lot have children after they have their abortions. So I think about myself and my family and just the number of us who are here because people in our lives, in our legacy, in our ancestry had abortions and were able to make the decisions. And it's so frustrating that this assumption that because those abortions were had, that like there are missing people, actually in a lot of families, including like, a lot of my extended family, I can count family members and people who are here because someone was able to get an abortion, multiple people, right? The other piece in that this idea, like, it's somehow Black abortion genocide. One, they went with the stat that like abortion clinics are more in Black communities, even though that's like cherry picked data, because it literally is like, if you look at their data, they're basically saying that abortion clinics in like Vermont and Maine, because they happen to be near the several Black folks who live in those states, therefore it's targeting them because it's in a major city. So they pick the whitest of states to like prove their point, which I was like, okay. So they're using that as their point. But also this idea that if you're saying Black abortion genocide, who is actually doing said genocide? And they're actually blaming Black pregnant people. They are blaming us for making our own health decisions, right? And they've had billboards that demonize us for years, that basically say the most dangerous place for a Black child is in the womb. And that plays on so many disgusting racist stereotypes about Black mamas, about Black parents and violence, especially at a time when we are watching Black and brown kids being shot in the street. The majority of kids who have died from coronavirus are Black and brown kids. We're watching this administration lock up Black and brown kids and separate them from their parents. And so it's really deeply offensive, and is particularly targeted at this specific level of misogynoir that goes after Black people, Black pregnant people, as the perpetrators of our own suffering or harming our own people, without actually having to look at the racist capitalist systems that are in place that are allowing this administration and all of the administrations in the past to just like lock up Black and brown people and murder Black and brown people with impunity. Sorry, I got real deep there.
No, I think Moji froze. So that is a bummer. We could talk all day, Renee, but we have to wrap.
Yeah.
I hate that. I hate that we have to wrap up. Thank you so much for just being so thoughtful, so smart, just championing everybody who needs to be centered in this conversation. And for being part of a community that I'm super proud to be part of. And I hopefully we will see you in 2021. And let us know how we can do to better all the world.
Just, you know what? Love the people in your lives who've had abortions. If you've had an abortion, you want to share your story, do so on your own terms. And if you haven't had an abortion, go out and get one. Join our crew. We're recruiting.
Clean it out.
It's great.
Clean it out. It's good.
Normalize.
Renee Bracey Sherman, you're the best. Thank you.
Thank you. You're the best. Thanks for having me.
That was amazing, guys.
She's so funny and smart and great. I love talking to her because she always, to quote like Marie, she's always centering the people that we're fighting for all the time and reminding folks. And she's so good at it.
Yeah.
Yep.
I think that's really what it is. I feel like we've talked to so many people and it's come to like, oh yeah, the people who are affected are really excluded. And I feel like she really brought us back to like, and the people who are affected are who I'm talking to, and we do all we can to make sure that their voices and stories and our opinions are out there.
And Dahlia Lithwick highlighted how this third party, like these are the people that the courts need to listen to. So like we unfortunately need people, we need organizations at all these points to make sure, because we know the antis are not going to be looking for the actual people, the patients, the folks on the ground that need abortion. So that's why orgs like We Testify have to exist to literally say, well, here, this is a population. Look, acknowledge this. Look at these folks' testimonies. It's just so frustrating.
I know. And it's so, it's just refreshing to be reminded constantly that people have abortions all the time. They have abortions. It is not anything that should be decided by anyone other than the person having the abortions, and just reminding people that you have to be proactive about it and you have to say it. Running away from it means that you are not going to advocate for it, and we're going to find ourselves in these shitty ass positions constantly if we don't normalize it and make it be stigmatizing to talk about abortion in a way that's shameful. Let's stigmatize the shamers. I'm for that. I am for that kind of stigma.
Yep.
Also, it was really interesting. I love that you asked specifically, like, what did the anti say? And it's like, oh, they said my mom had choice.
Yeah.
All we want.
Yeah.
And I love how Renee touches on like, yes, they're focusing on abortion storytelling, but she doesn't have blinders on. She's like, no, abortion storytelling facilitates miscarriage storytelling, facilitates all these positive pregnancy stories that people have gotten to have should they choose to have a family. So much of that is tied to an abortion incident, a miscarriage, like that is all part of the storytelling of your family, of your creation, or you choosing not to have that.
True, exactly. And every time somebody says, it's a loss of life, it's like, I wouldn't be here if it wasn't for abortion. Like, what about the fact that I exist? Like, does that not count for anything? I'm not saying my mom had an abortion, because I know she did.
They're very much looking like every acorn and being like, here's a tree. And it's like, no, it's just an acorn.
Also, if every person was born, there'd be no place to stand. I just want to put that out there in the universe. Yep. It's just like a logistical situation that our planet would be on fire constantly. It already is, but it would be worse.
Yeah, we know we don't already acknowledge environmental needs that we need to.
No.
With our current population, we can't. Also, when we're putting them in cages,
Yeah. So 2021, we have a lot ahead of us because we have to really be drilling down on who is elected in these legislatures, what laws are passing, and really working our own selves on telling the abortion stories that we can and busting the stigma, because without stigma, you can't have shitty law. We can't have shitty laws, yep. And taking back the narrative, I think, is crucial.
I agree. So guys, this has been super fun.
I think more video casts are in our future.
I'm ready for that.
I know. If I'm not going to be able to see you guys in person, I want to be able to see you. And also, I don't think we can't just before we kick off, we cannot go and talk without mentioning the elephant or the black cat in the room, because God. Marie, your cat was like a man trying to listen in on a bunch of women talking at a bar, walking by, listening. Hello, God.
This is Shaka Khan. She's all about abortion access, pregnancy justice, pregnancy care,
all about all of it, because she was just like boom, boom, boom. I loved it.
The perks of a studio apartment.
Wow. So y'all, we're not going to see each other until 2021.
No.
Oh, we won't.
So thank you for the amazing year. Thank you for your insights. Here's to all great podcasts coming forward in 2021. And listeners, we will also miss you. Moji, take us out with everything they need to know.
All right. So, you spend your time with us and you need to maybe, this is the year in the seasons of giving. Write us a review. Give us 5 stars. Let people know how to find us. And that's writing us a review of 5 stars is one of the best ways to do it. Also, you can follow us on social. We are Access Force on Twitter, on Instagram, on Facebook, on TikTok, on YouTube. It's a little late for holiday giving purchasing now, but maybe you want to take in the new year with some swag. Why don't you send us a note and we can send you.
I just got mine in the mail.
Huh?
I just got mine in the mail.
Just today, literally.
I'm showing it right now. It's so good.
Mugs. These are things we have. And as always, we are grateful for Brad Pearson for our producing and our editing. Our theme song is by Cory Eischen and the Purple Xperience. Finally, donate. You can go to accessforce.org. There's a donate button there. Give us some coins.
We do this for free.
For fun and for the knowledge. And finally, may the Abortion Access Force be with you.
See you in 2021.
Happy New Year.